It didn't take long for Cuyahoga County to soar to the very top of Ohio's weekly case rates per 100,000 residents in mid-December, with more than 1,200 cases per 100,000 residents. Within just 1 week, that number had doubled to more than 2,500 cases per 100,000 and then peaked at over 3,000 cases per 100,000 1 week later. Now, as we enter February, that number has plummeted in Cuyahoga County to 268 cases per 100,000. And Cuyahoga County now has the lowest cases per capita of all of Ohio's 88 counties. This dramatic climb and subsequent fall illustrates the rapid cycle of Omicron. As these cases skyrocketed from mid-December through much of January, record numbers of people headed to the hospital for testing or treatment, crowding emergency rooms and filling our hospitals. Hospitalizations reached a pandemic high of 6,749 patients on January 10th. And thankfully, that number has been falling daily ever since, now at 3,464, which is a 48% drop. Still, a very high and very concerning number. In the last 3 weeks, hospitalizations have declined 65% in the Ohio Hospital Association's Northeast region. Now that's Greater Cleveland. They've declined 60% in their East Central region. That would be the Greater Akron-Canton area, and 44% in the Northwest region. Now that includes Toledo. These were the regions of the state that were first hit the hardest. Hospitalizations are declining in other parts of the state, but they're not dropping as quickly in those other parts yet. Despite these improvements, some Ohio hospitals continue to manage very high hospitalizations for COVID-19, but the ongoing decline in hospitalizations is allowing many hospitals to resume services that needed to be postponed during this most recent surge. Due to the continued extraordinary number of COVID-19 cases, especially in the southern half of the state, many hospitals continue to require the support of the Ohio National Guard, even as other hospitals are now able to transition away from Guard support. The Ohio Hospital Association continues to actively partner with us in surge planning to ensure that healthcare services continue to be responsive to the local needs of each and every one of our communities. So we are feeling hopeful as we begin February that better days are ahead. But remember, we are still a very long way from having case levels like those we were seeing in the late spring through the early fall. Our cases per capita are still, as a state, more than 10 times what is considered high in terms of levels of transmission. Now, as we look forward, there's no crystal ball to tell us what will be coming next. COVID-19 is almost certainly here to stay. So now the question for us is, how do we learn to live with it? And at what point have we moved from something that's truly a pandemic to something that's more endemic? And how do we make that transition in the best way? Joining us today is Dr. Joe Gastaldo, Ohio Health's Medical Director of Infectious Diseases. He's joining us to help us reflect on how far we've come in the last 2 years and what we might expect as we transition from a pandemic footing to one that's a little bit more of an endemic state. Dr. Gastaldo, can you first help explain for us the difference that scientists mean when they talk about something being pandemic versus endemic, and some examples of diseases that people might know that are considered to be endemic diseases?
Yeah, first of all, Dr. Vanderhoff, thanks for having me again. It's my honor to be here and addressing at this press conference. So in the scientific world, we use the word pandemic really to emphasize that it's spread of a disease or an infection in the setting of COVID-19 in a population who has no immunity. And when we say the word pandemic, it really is a worldwide phenomenon. And that's really exactly what happened with COVID-19. We had a novel coronavirus appear in our population where nobody in the world had any degree of immunity. So as a result, we had widespread this virus going throughout the world. Now, endemic is a word that we use to describe a disease or infection in this matter that essentially persists in the population indefinitely. Now, in the setting of what this specifically means for the virus, it really means that instead of these big peaks, there is likely to always be a baseline level of some type of infection or activity going on. And it may go up or down based on the seasons. For example, with respiratory viruses like influenza, we typically see them more in the winter months.
Thanks. Now, so thinking about that and thinking about moving from this being pandemic to something more endemic, maybe like influenza, can you share with us some of your thoughts about, well, what are the factors that go into that? How might Omicron have actually played a role in helping us make that shift? How can we think about what leads us from the one state into the other?
Yeah, and that's a great question. It's very complicated, but it kind of boils down to this immunity. The first thing I want to say is the safest way to get exposure and immunity to this virus is vaccine. We now have two vaccines that are fully FDA approved. But nonetheless, through vaccines and people having exposure to this virus in their environment and their day-to-day lives, we are left in the background of more people having various degrees of immunity. Excuse me. And in that context, it's that type of immunity that will give protection to people, most importantly, from severe disease resulting in hospitalization or death.
Thanks. And so extend a little bit more because we've talked a lot about immunity. We've talked a lot about the importance of vaccination in securing that immunity for each and every one of us. But of course, there's also, I think, very valid discussion about natural immunity. And can you share a little bit about the roles that both vaccine-based immunity and immunity that we get from an infection play?
Yeah, that's a great question. Again, it's a complicated question, and it basically boils down to this. Yes, it is true. If somebody does get COVID, most people are left with varying shades or degrees of immunity. And as everybody knows from talking about this, it's very complicated. There's immunity from infection and immunity from severe disease. Now, somebody's immunity that they get from natural infection can be variable from person to person. For example, somebody who is younger is likely to have a better degree of immunity compared to somebody who is older. So immunity that you get is variable. What we do know is that the immunity you get from vaccines is not only better than natural immunity, it is more observable and it's something that can be studied more in the real world. And we also know too that for somebody who has had COVID, it is safe to vaccinate them. And actually, they are left with what we really call hybrid immunity, which is a better type of immunity than immunity from natural infection or immunity from being vaccinated alone. Nonetheless, it does boil down to what we said before. As time goes on, as more people get vaccinated, as more people get exposed to this virus, in the aftermath of Omicron especially, we are left with more people with degrees of immunity. And again, if you are vaccinated, if you get a booster and you get a post-vaccination infection, and you're home with a cold or mild symptoms, that's the vaccine working.
Thank you so much. Thank you, Dr. Castaldo. Well, for COVID-19 to progress in this evolution to a more endemic illness, one thing's clear from Dr. Castaldo's comments, we need to have enough people who are protected with strong immunity, and vaccinations are clearly a big part of that puzzle. Today, 6.6 million Ohioans, or 60% of eligible Ohioans, are in fact fully vaccinated. 32% of eligible Ohioans are boosted. But that means there are still Ohioans who are eligible, but not yet boosted. As we move forward, we need to continue to see our vaccination numbers rise to boost our state's immunity. Vaccination rates are currently lowest among some of our youngest Ohioans. For example, approximately 47% of those 16 to 17 are fully vaccinated. Approximately 42% of adolescents between 12 and 15 are fully vaccinated. And approximately 19% of children 5 to 11 are fully vaccinated. And only a small fraction of those are now boosted. Further research reported in the CDC's latest Morbidity and Mortality Weekly Report, a regular publication, affirms the importance of getting booster vaccinations. The truth is, you're in a much better spot if you keep your vaccination up to date for COVID-19. And that's especially true if you're over the age of 50. It's clear that there is a real benefit to keeping your vaccine up to date. Getting vaccinated with the primary series is the first and most important step in that journey. Joining us next is Dr. Patty Manning Courtney, Chief of Staff of Cincinnati Children's Hospital, to share some of the trends in COVID-19 cases, children and teens, and what we're doing with vaccinations. So, Dr. Manning, with comparatively lower vaccination rates among children and teens, coupled with a highly contagious variant, how is the Omicron variant impacting our children?
Well, thanks, Dr. Vanderhoff. And as always, it's an honor to be here. I can tell you that Omicron had a significant impact on kids. We saw a dramatic rise in our hospital and in children's hospitals across the state in hospitalized children at the middle to end of December. And previously I had not shared exact numbers of hospitalized children in our institution, but we went from the high teens, low 20s to 30, 40, 50, 60 plus hospitalized children in a matter of weeks. And it was terrifying to see that many children testing positive, coming to the hospital, being ill with COVID. So it had a dramatic impact, as it did on the general population. Children were not spared, even though people think of children as not being impacted by Omicron.
Thank you for that. Unfortunately, some parents may mistakenly believe that COVID-19 really does not pose much of a risk to their children. We've talked about hospitalization, but of course there are other ongoing risks. Could you outline what those risks are, especially for those who are not yet vaccinated?
So the children who are not yet vaccinated, much like the unvaccinated adults, they're at greatest risk, not just for getting COVID, but for having serious complications from COVID. We know that the vaccine is protective from severe disease. So the children that have been hospitalized across the state are largely unvaccinated. The ones that get the sickest are definitely unvaccinated. And then there are the children who get other complications, like you've heard us talk about MIS-C. Our colleagues up north in the children's hospitals in the Cleveland and Akron area shared earlier this week on a call that they're seeing expected rises in the cases of MIS-C. This is the post-COVID inflammatory process that we see in children that can be quite severe, can involve the heart. And we're all bracing for those numbers to go up across the state as we have seen these skyrocketing numbers of children with COVID.
What are some of the concerns that parents have raised to you and your colleagues about vaccinating their children for COVID-19? And what would you say is your response or what you'd want them to understand about these vaccines and their safety profile?
So the two concerns that parents raise the most about this vaccine that I hear are, number one, the long-term effects, and number two, some ongoing concern about fertility. To the first concern, I say this: we are so fortunate to know that the way that vaccines work, all vaccines, including the COVID vaccines, that they work quickly and then they're done. And they don't stick around, they don't hang out in your body and cause long-term effects. So even though the COVID vaccine hasn't been around long, other vaccines that are similarly derived have taught us that vaccines don't cause serious long-term effects. What does cause serious long-term effects is COVID. And so I tell families that I'm much more concerned about the long-term effects of an actual COVID infection, even a mild COVID infection, We have seen hundreds of children here at Children's Hospital in our outpatient clinics for ongoing COVID symptoms of fatigue, respiratory issues, some cardiac concerns, some neurologic concerns. That's far more common than any kind of long-term effect from the vaccine. To the fertility question, I say, and this is one of those frustrating issues that where a seed got planted, a seed of doubt got planted around this side effect. It's just simply not true. We just haven't seen that. There's no evidence, there's no basis for that concern. And so I'm just simply not concerned about any kind of fertility impact from these vaccines.
So, in terms of your experience as providers, as pediatricians administering this vaccine to kids, how would you compare your experience with this vaccine thus far to the many other vaccines that you give?
It's a great question because it's actually very similar. Children are amazingly strong and resilient. They handle the vaccines that we give them regularly and routinely very well, and they've handled the COVID vaccine very well. In fact, you could argue with some evidence that the children have handled the vaccine better than the adults have in terms of side effects and tolerance. So it's been a very similar experience to us, to other vaccines, which makes us, again, as pediatricians, very comfortable making these recommendations. To us is no different than the other really serious illnesses that we ask you to protect your children from by getting them vaccinated.
Thank you. And of course, now we're at roughly 2 years of dealing with this pandemic. What would your message be to parents and for in terms of what the best things they can do to be protecting their kids from COVID-19, given the fact that we're saying COVID-19 is probably with us to stay?
Exactly. So COVID is here to stay. And we're so fortunate to have tools that can be protective and can help us learn to live with COVID. So to parents, I say this: if your child can be vaccinated, please vaccinate them. There are so many opportunities to talk to your pediatrician, your primary care provider, whoever your trusted partners are in your child's healthcare. Talk to them. They will encourage you to get your child vaccinated. If your child's too young to be vaccinated, then you've got to continue the safe practices that we've talked about, limiting some exposure to crowds or to people that you don't know their vaccination or illness status, using masks where appropriate. We're also encouraged that the rates of disease are coming down, but as you heard Dr. Vanderhoff say, they're still very high. And so every effort needs to be made to protect the individuals in our lives who are most vulnerable, and those are the unvaccinated, the elderly, the ill.
Thank you, Dr. Manning Courtney. Now I'd like to share some good news about our efforts to provide access to rapid COVID-19 tests for all Ohioans. The state has purchased and has distributed, or is in the process of distributing, 5.6 million tests. And now we're seeing an increase in the flow of tests to the state. Ohio distributed 875,000 tests in the month of January. Early in the month, when acquiring tests was particularly challenging, the priority was to send tests to our K through 12 schools to help them stay open and to keep our children in the classroom, where, of course, evidence shows they generally do the best. More recently, as supply has begun to improve, the state has been able to send more tests to our community partners, including libraries and community centers. Of the 875,000 tests distributed overall last month, 385,000 were delivered to those partners. Ohio's comprehensive testing strategy has many prongs. Of course, any Ohioan can order up to 4 free tests through the federal government's national initiative. And last week, we announced a partnership with the Rockefeller Foundation called Project ACT. Our partnership with Rockefeller represents an additional opportunity for us to get more tests into Ohio. It's additive to our testing capabilities and complements our other efforts by making up to 175,000 new tests available to some of the most vulnerable areas in the state. We're excited that Ohio is one of only a handful of states that will have this opportunity. And we'll continue to seek out new and innovative ways to meet our state's need for testing in all of our communities. In addition, Our department continues to work closely with the Ohio Hospital Association and the Ohio National Guard to support testing sites across the state. The Guard is currently supporting 16 testing locations, and this effort has helped to relieve the burden on emergency departments as well as to increase access to testing in many communities. Our focus is to continue to evaluate our testing needs and to stay flexible with our distribution strategy in the midst of what has continued to be a very dynamic national situation. Throughout the COVID-19 pandemic, our response has consistently evolved, even as the virus has evolved. And this will continue to be the case as we approach the next phase of our response to COVID-19. Endemic diseases are all around us, from the common cold to the flu. We don't know if or when COVID-19 will join that list, but we do know the continued efforts to reduce the spread of this virus and to increase immunity are critical to getting us there. Now, vaccination remains more important than ever. Now that the two messenger RNA vaccines, those from Pfizer and Moderna, have both received full approval by the US Food and Drug Administration, Ohioans should feel an added layer of confidence in their choice to get vaccinated. Earlier this week, the US Food and Drug Administration granted full approval for the Moderna COVID-19 vaccine for people ages 18 and older. This is the second COVID-19 vaccine to receive full FDA approval. The Pfizer vaccine received its approval last August. Moderna's FDA approval is another milestone in our ongoing fight against COVID-19. The Moderna COVID-19 vaccine meets the FDA's high standards for safety, effectiveness, and reliable manufacturing quality, features required of any vaccine to receive approval for use in the United States. More than 200 million doses of the Moderna vaccine have in fact been administered in the United States, including more than 6.3 million doses right here in Ohio. Staying up to date on COVID-19 vaccinations, including getting a booster when eligible, is the best defense that any of us have against COVID-19. Remember, children ages 5 to 11 can get a version of the Pfizer vaccine that has been formulated just for kids. And children 12 and older can receive the primary vaccination series plus a booster. While children are less likely than adults to get severely ill from COVID-19, as our guests have shared today, they are certainly not invulnerable. Children get sick from COVID-19. They can spread it to others, and some, sadly, will suffer severe health outcomes from COVID. Getting vaccinated against COVID-19 can lower your risk of getting and spreading the virus that causes COVID-19. Vaccines can also help prevent you from having serious illness and, of course, death. All steps have been taken to ensure that our vaccines are safe and effective for people who are receiving them. Protect yourselves and your families from what is still to come. If you've not yet been vaccinated, please talk to your doctor or healthcare provider and get the facts, and then choose to be vaccinated. Thank you.